Gary's going to talk to us about HIFU, High Intensity Frocused Ultrasound, that treatment that Gary had.
Thanks very much for having me here tonight. I really appreciate that. First thing I want to start off by saying is I'm not here to endorse what I'm going to tell you about tonight. I'm not a doctor. I don't pretend to be. I was a teacher for over 20 years, the last 17 years with Calgary separate, high school and junior high. I quit that 8-9 years ago to get into the financial world. I'm a financial advisor today, so I believe in education. I think it's the key to making good decisions on anything. So I'm really here just to give you a bunch of information tonight. I'm not an expert. There's some people I'm sure out there that have forgotten more than I know about the subject, but I'm going to kind of tell you, we're going to do 4 things today. First of all, I'm going to tell you my story and how all this happened to me and what I did about it. And we've got some audio-visual things if Rob can get this thing going. And you'll actually see what the procedure looks like. And then I'll give you more information and facts that I found out in my research, and then we'll have some time for question and answer. So we'll do those kind of 4 things. Sound good?
Yep.
Okay. So just to give you a little bit about my background, I'm a Manitoba boy, and I've been here in Alberta since 1978, and came here to be a teacher because I couldn't get a teaching job in Manitoba or Ontario, where I went to university. So I ended up out here, and like I say, I started teaching in Pincher Creek, taught in High River, and then I ended up teaching for Calgary separate for many years. And I'm married. I have 2 children. A boy that's going to be 21 tomorrow, actually. He just got back from Germany on a student exchange from University of Lethbridge. He's in 3rd year of business, and that's pretty special. I have a daughter that's 16 going on 28. That's the one that's giving me the gray hair. And she's 16 and a half years old. And when I turned 50, something happened to me. Some people get depressed because they turn 50. I was very excited about turning 50, and so I went on this health kick. And I've never done drugs. I've never smoked. I could be blamed a few times for having consumed too many alcoholic beverages on occasion, like beers and stuff, but like a lot of people. But pretty healthy guy. And as of 3 years ago, in a couple of weeks, I'm going to be 54. And when I turned 50, I got a membership to a club, and I now belong to 2. I work out 1 to 2 hours every day and have been for years. I eat well, lots of fruits and vegetables, and I jog and I work out, and just a real healthy guy. And like I said, for the last 9 or 10 years, I've been in the financial world. Well, a brand new product came out that we started endorsing with our company. And I guess I'm of the belief that if you're going to sit down with people and tell them about some of the products and services that you have, you should own the product yourself if you believe in it that much. So I actually applied for a new type of disability insurance. This is about a year ago, and I got turned down. I give this company a fair amount of business, and so I called the underwriters and I said, "Are you kidding me? Like I'm about as healthy a 50-year-old guy that you can find." And they said, "Well, we can't really tell you what's wrong. We can only send it to your doctor." And I said, "Well, not only am I the financial advisor and the agent here, but I'm also the client, and I'd like to know why you would have turned me down. It didn't make any sense to me." So they sent the information on to my doctor, and I found out that I had a PSA level of 3.1. Now, for those of you that have had prostate cancer or have been looking into it right now, that's not an extremely high number. And my family doctor said to me, "I don't know why they would have turned you down. That's pretty normal for a person that's 52 years old, 53 years old." So I wrote the company back, and to make a long story short, they said, "Well, get it checked again, and then we'll take a good look at it." So 3 months later, I had it checked out again. Well, now it's 3.6. And you know the story, those of you that have been around it. And my family doctor said, "Well, I still wouldn't worry about it. I mean, that's not a good sign." And I said, "Well, what exactly is this?" "Well, it's a chemical at the I didn't even know what a prostate was. I don't think most people do. I would say that 90+% probably, if I was a guessing person, doesn't even know what a prostate gland does until something happens to you, and then you start to research and find out about it. So I did, she asked, my doctor asked if I would have another test done about 3 months later. Well, I did, and now it was 4. And so she said, "Well, that's not a good sign. I wouldn't be really alarmed, but if you want to sleep at night, go get a biopsy done." So to make a long story short, in January, I had a biopsy done here in Calgary, over by Elbow Drive and Glenmore Trail. And my urologist called me in and said, "You're positive." Well, my jaw dropped. I guess like anybody that hears that they have something called cancer. It's one of those things that you know exists out there, you just never think it'll happen to you. True? I mean, that's pretty much. You know it has to happen to somebody, but it's a shock when it happens to you unless you smoke 2 packs of cigarettes a day, and then I guess you have a better chance of getting it. So I was kind of in shock for a few minutes, and I asked the urologist, you know, what are my options? And basically I heard quite a bit of information about surgery. And I thought, okay, I mean, I don't know anything about this. How fast can we get this done? And then I asked a crazy question, because I'm a teacher, I guess, and I said, like, are there any things I should know, like side effects? And I didn't like what I heard, because the 2 things that I heard that, and then my jaw really dropped, was this is going to affect me sexually quite a bit. And number 2, I may be wearing Depends or some kind of diaper or clamp or something for the rest of my life. And I jog and run, and I'm a cross-country ski instructor, I'm a canoe instructor, I mean, I'm a pretty active guy. I just didn't like what I heard, so I thought, I think I need a second opinion. So I went downstairs, and I grabbed a few pamphlets out of the Prostate Institute clinic that's down there. And then I went and found the head volunteer, and I said, I think I'd like to volunteer. So I've been volunteering now for the last 4 months, and for 2 reasons. Because before I went into my doctor, he told me I had cancer. I was sitting in the waiting room with a gentleman who told me he just found out, and he had less than probably a year to live because he caught it too late. And it kind of dawned on me, my gosh, I'm pretty lucky. My biopsy was 1 out of 10 needles. When they do the biopsy, they stick 10 little needles into your prostate gland, which is only about this big around. And one of those needles had cancer in it. So they caught mine pretty darn early. And I look at my job as a blessing, because if I hadn't been applying for the disability insurance, I'm a pretty healthy guy. I wouldn't have noticed anything, I'm sure, until a few years later when I started maybe have bleeding from my rectum or maybe urinary problems or something, but I didn't have any of those things. So I look at this as a blessing. And I realized that if I volunteered at the Prostate Cancer Institute, 2 things would happen. I could help gentlemen that were probably worse off than me, or maybe had the same shock that I had, but I'd be able to find out a heck of a lot of information. Well, I think I lived there for about the first 3 weeks. I mean, I read, oh boy, I spent hours there. I took books out. I was on the internet. I called people in Germany. I called people in France. I called people in the United States and across Canada. And I read manuals, and I looked on the internet for every report there was to find out all the different methods that you could cure this disease with. And my wife one day said to me, you know, I was just clicking on some things, and I found this thing called HIFU. And I said, what? Because I read up on the brachytherapy and cryotherapy and the surgery and laparoscopic surgery where they go through your belly button with a little robotic arm. And I was looking at all these things and trying to figure out which one would be a good option. And I started reading up about HIFU. And I didn't know anything about this. And what I found was that this is really relatively new in Canada. Western Canada, nobody knows what you're talking about when you mention HIFU. Very few of the doctors are really aware of what it's all about, and I think they kind of shun it because it's still in its infancy stage. And I will tell you, what you're looking at right now standing before you is a great big guinea pig, and I realized that going in because they don't even allow this procedure in the United States. From any of the readings that I've found, and in Canada there's only really 1 place, actually 2 now. They just opened up a clinic in Winnipeg apparently about 3 months ago, but really Toronto is the only place where they do this in Canada. So I started reading up on HIFU. Well, then I found out there's 2 kinds, there's so many methods, and I found out there's 2 kinds of HIFU treatments. And we're going to talk a little about the difference today, and why I'll tell you the reason why I chose the one that I chose. But I started reading and finding out about this HIFU, and then I contacted 2 different companies in Toronto that offer these procedures. And I found out, well, they don't take everybody, because HIFU is not for everybody, and you have to have a certain kind of medical condition with the prostate cancer. You have to be within certain limits. So if you have number 1 thing I guess I could mention here is if you have very advanced prostate cancer, they probably won't recommend HIFU for you, and it probably isn't for you. If it's metastasized and it's gone outside of the prostate, they really can't use HIFU on you. I have heard some interesting and read some interesting things just in the last little while. They're saying that this may be the new method for doing brain surgery on tumors and things like that. That's how good they're getting at this. Now I'm sure that's years down the road, but that's pretty neat when I heard about that. I mean, I don't have anything like that for the thousands of people that have that kind of a problem. Wouldn't that be fantastic if you could shoot sound waves at it and kill the thing? So I started finding out about the HIFU. Well, I found out it's not covered by insurance. It's not covered by Alberta Healthcare. It's not covered by something called OHIP in Ontario. And so you have to go to a private clinic. And I did some researching here in Alberta, contacted the government. Nobody's going to fund this thing because it's relatively new. The studies on the thing, and I'm going to give you more information on that, are few and far between, and compared to the other procedures, just there's not a lot of great evidence on the results of this, and especially long-term results. So I narrowed down from my information after about 2 weeks of, again, more phone calls and more reading and more information. I narrowed it down to a machine that they use called the Sonoblade system. There's two systems. One called an Ablatherm and one's called a Sonoblade. And one is basically robotic controlled and one is doctor controlled. But the machines basically do the same thing. HIFU stands for High Intensity Frocused Ultrasound. So really it's a bunch of little sound waves. They zap your prostate, superheat the thing, and they basically cook it kind of like a microwave oven. And that's really what they do. They cook the whole gland, plus they cook the cancer that's inside of it. But how it's administered is two different things. One's done totally by a little robotic arm, and it does all the shooting of the rays, and the other one's controlled by the doctor's hands. I chose the one that's controlled by the doctor's hands, and I'll tell you again a little later why I chose that method. Well, I found out that the price tag for this is $22,000. And you can actually have two procedures done. If the first one doesn't get it all and your PSA tests come back positive down the road, you can always go back for a second zapping, I guess if you want to call it that. And the second one is $10,000. Well, I don't know if it answered that, and I'm not doing too bad, but that's a lot of money. Is it worth spending that money to save your life? That's a silly question. Yes, absolutely it is. But somebody again up there maybe was looking out for me, because when I spoke to the head nurse in Toronto for about the 20th time, I was talking about the price of that, and she said, you know, we're currently doing a research study right here in Toronto at our clinic by the 5 doctors that run this organization. Would you be interested in being part of our research study? And I said, what does it involve? And she said, well, you would have to fly out here, and you're going to have to anyway, and get the procedure done. And then there has to be a little bit more follow-up. Every 3 months you have to fill out a questionnaire. You have to have a biopsy every year for the next 5 years, and you have to send results back to us, and just a few little things like that. And I said, well, what's the price drop down to if I do that? And she said, 0. So I said, well, let me think about this. $22,000 or nothing. A repeat procedure, $10,000 or, and I said, what if I have to come back for a second hit? And she said, we drop it down to $2,000. Just for the time with the nurses and the machinery and so forth. So I went for it. I got my name in. I was the 3rd last person to get in this research study. Plus I like the fact that I was in on that, because I think not only being a guinea pig, any information they get from what happened to me, somebody down the road, 2 or 3 or 5 or 10 years down the road, is going to be looking at that information and deciding whether this is a viable, methodology to use to get at their prostate cancer, or it's not. So I'm kind of proud to be part of that study, and I want to see myself what the results are. I met several of the men that were there in Toronto when I had the procedure done. Well, then I looked into it a little bit more, and I found out, well, you also have to qualify, even though you're in the study, or whether you're not in the study, you have to qualify with certain parameters before they even let you in. And one of the things that they told me is if you have a Gleason score of 7 or higher, that they will not do the HIFU in that clinic, and they will certainly not have you in the in the research study. So in terms of biopsies, you can't have any more than 5. Well, I had 1, so I think to them I was a pretty good candidate. I'm probably going to help, hopefully, make their numbers look good. I will tell you too, I don't know if they got it all or not. So I don't know if I still have cancer in me or not, because my appointment with my doctor is actually on the 20th of August. It's Wednesday of next week. I had my blood test last week, and my urologist is going to tell me what my PSA level is. So I'm praying a lot and crossing my fingers and hoping he's got some good numbers for me. The better number actually is after 6 months. So I'll have this PSA test that's happening right now, and then again in the fall. So I'll pretty well know in November how effective that procedure was. So I found out that in order to get this done, they give you an epidermal. obviously they don't want the lower half of your body moving, so they wham you in the back with these super monster needles. Well, I'm not much of a needle lover, and but I thought, well, you know, I have to do this procedure. Then you have to wear these epidermal, I think that's what they call them, stockings. They're these big tight stockings that you put on so that you don't get an embolism, you don't get a blood clot in you. I don't know what it's like for the guys in here. I've never worn stockings before, and pulling them off.
It's really sexy, right?
Yeah, my wife got it like real hot. Anyway, so you have to fit into these parameters where your Gleason is good, and it hasn't metastasized, it hasn't left the capsule of the prostate. HIFU does not work if it goes outside the, you know, especially if it goes into bone. I guess the waves cannot go through bone matter. So, I mean, this is a procedure that is not obviously for everybody, and you have to fit within those parameters. I found out that before the procedure, you can't eat for about 3.5 days, and the last day and a half was nothing but clear fluid. So, but the good thing that I found out about this procedure is it's a walk-in clinic. And that's the thing that I really liked about it. I'm looking at a procedure that is very non-invasive. Nobody's cutting you open to have this done. There's no surgery. Basically, they're putting a probe inside your rectum, and this little machine has two things. It shoots out little sound waves, and it gives them a 3D picture on a screen, and it also emits these little sound waves that actually do the destruction and burn the inside of your prostate gland. And so, you know, to me, I just looked at this as a very viable type of solution, and the statistics that I read on the two things that really concern me, the three things really. Number one, obviously my first concern is I want to make sure I get rid of this cancer if possible. But number two, the sexual function, and obviously the urination functions, where I would be able to urinate, you know, normally like I used to. So I went in, I had this procedure done on April 27th. They did not cover my plane fare or hotel rooms, and that was a small price to pay, I thought, for having the procedure done. The clinic that I went to, it's called the Can-Am Clinic, and by the way, I'll give you for those of you that are interested, the names and addresses and phone numbers and contact numbers if you'd like them. Again, I'm not endorsing them. This is not for everyone. I suggest you talk to your urologist or your doctors if you're thinking about having this done. But I don't know, for me, I was pretty happy. It was a walk-in clinic, and because I was such a large guy, I weighed 200 pounds and I'm 6'3", and they gave the doctor there gave me 2 needles. And so when I came out of this thing after about 3 hours, it takes about 3 hours to have the procedure done. I was supposed to be walking within half an hour to 45 minutes. Well, 2 hours later, I'm still sitting on this bed, and I've got these 2 nurses with worried looks on their faces who are saying, "Come on, wiggle your toes," and kind of nothing's happening down there. And then I'm thinking worse, because maybe they stuck a needle in my spine or something, and I'm going to be in a wheelchair the rest of my life. You have all kinds of crazy things happening. But eventually, because they put so much of that in me, it took about 2.5 hours. Well, within an hour, I was walking back to my hotel room in downtown Toronto, which is about 1.5 kilometers away, which is good because it got rid of all the anesthesia and everything. But it was really neat. We went straight to a restaurant and ate like I'd never eaten before. The only thing that I was surprised, well, I guess I shouldn't say surprised at, just it was new for me, was you know, I've never peed into a bag before. I've never had a catheter before, and if you've never had a catheter, it's quite an interesting experience. They put in something called the suprapubic catheter. So they basically put it right in the middle of right in between your belly button and your penis. They stick that in behind your pubic bone and up inside into your bladder. Well, they give you a little bit of instruction on how it works, and then, of course, a nice pamphlet on what you should expect. Well, we flew back. They suggested you don't fly home that very day that you had the procedure, so we waited until the next day to fly back. I guess, again, just so you don't get an embolism or a blood clot. Well, I have an interesting story. The first night, of course, I put on the old feed bag. I put on the night bag. For those of you that have ever worn a catheter, you know the joy of switching to the night bag instead of the nice little one that clips onto your leg. This bag is pretty darn big, and I clicked it on. I was so tired from the flight, I went to bed at 10 at night. I woke up 4 in the morning, just doubled over in pain. And I looked down at the bag on the floor, and it's totally empty. And again, I'm not sure how catheters are supposed to work, but I know something's wrong immediately. And I feel like I've been to a Flames game, had about 12 beers, and I'm in a lineup, and I'm just not making it to the urinal in time. That's what I feel like. Guys that have had too many drinks or coffees or beers, you know what I feel like. So I was in extreme pain. And of course they tell you, drink lots of water. After the operation, drink. So I was drinking these huge plastic cups of water, and I'm in real pain. My wife rushes me over to Rocky View Hospital, and I could barely walk from the car. I mean, I was just in agony. And I got in there, and of course, and the nice thing about the clinic, they gave me a nice little brochure that if there's any emergency, and it says, hello, medical practitioner, your client has had HIFU, here's what it is, here's how this catheter works, et cetera, et cetera. The head nurse there at Rocky was so good. She looked at me and she said, so we have to stick a needle in there and shoot a saline solution. Then she looked at the little catheter coming out, and there was a little valve there, and she said, well, I'll be darned. She said, look at that. Look at that big red thing right behind the valve. She says, I think it's on the outside of your body. So she took the valve apart, and again, I don't know how to take these things, like a little ring. She took it apart. Well, the urine shot went like a narrow garbage can, just like one of those little squirt guns. And she started laughing. She put her thumb over, and the doctor came over, and he goes, that's pretty funny. I'm not laughing because I'm double over. Well, they have these little cardboard, some of you have seen them, these little cardboard things that you go in the hospitals. I filled 3 of them. They're pretty big. And the doctor, by the time I was filling the 3rd of them, he was going, that's a lot of urine. You're probably feeling better. I'm going, oh yeah, I'm having an orgasm. I feel good. I feel good. Keep it coming. Well, then I came off the bed, and he said, let's, now that we cleaned the valve out, let's try walking because, there's going to be more that drains out. Well, I filled my little day bag twice. So he looked at the volume, and I said, doctor, if you don't mind me asking, is it possible to actually burst a bladder? And he said, it's rare, but it's possible. He said, you were probably pretty close. He goes, I've been a doctor, I think he said 14 years. I've never seen that much urine in anybody's bladder. Like, you were full. You probably were right up to your kidneys or something. Well, I had that happen to me the first night back. 3 weeks later, I woke up again, and I had pains again, and my night bag wasn't flowing very good. And this time there was no clot on the outside. They shot the saline in, and I guess it was something that had plugged up way up high. So I had to go again to emerge, and I had to have another one put in up my penis like they usually do. And so here I was with a bag over here and a bag over here, and I got a tube coming in here. Anyway, and again, I'm a financial guy, and I have a secretary, and I know there was one day there where I was just sitting there at the computer and working and talking to clients, and she was looking at me laughing. She's like, I think you should go and empty your bags out. And I looked down, and I just had like 2 bulges here. Both bags were pretty full. And then it suddenly dawned on me, anybody here know what Cabela's is? Cabela's is a fishing store down in the United States, and I thought this would be great for ice fishing, because if you had a bag here and a bag here, you can drink all the beer you want, you keep your legs warm while you're outside the I don't know if it's so or not. But anyway, I was draining from both of these very, very slowly, but enough from both, because they really didn't kind of know what to do at the Rocky View, because when they put the second catheter in, it wasn't draining really well either. And one of the things that happens when they burn the inside of you, which is what they're doing with these, of course, the prostate sloughs off, and it just fragments and starts passing out of your body. Well, also, because it's so hot, and because if you think about the prostate gland, I mean, it surrounds your urethra, right? So when they were burning that, I mean, obviously, they're burning somewhat with some of the rays, the inside of that. So they did put a camera up inside me, and I got to watch it. There's an exciting thing if you've never had that done before, watching a little camera go inside of you. But it was pretty red and raw inside. Most normal people, what I discovered from this procedure, wear a catheter for about 7 to 12 days. I wore mine for 6.5 weeks. I was getting pretty frustrated by the end because I only had a little bit of blood coming out, and they were saying, after several weeks, try to urinate, because it'll heal. And when I called Toronto, like I was doing about every second or third day, they said, of all the people they've done for the last 3.5 years in Toronto, I probably wore a catheter the second longest of anybody. The only guy that beat me was by 2 weeks, and I have to tell you this story because it'll make you all wince. The only reason he wore it for so long, the 3rd day apparently when he came home, He had the catheter, again, the suprapubic catheter in. His wife was backing out of the driveway, and he thought, my gosh, and he was going to tell her something to pick up at the grocery store, and he started to run. And this got caught on the doorknob.
Oh.
So he ripped it right out of himself, running full speed and catching the doorknob, and it caught the tube. And so he had to wear hers a bit longer than mine. So I didn't have anything crazy like that happen to me, but and what I dealt with apparently, and I spoke to several other people from that Toronto clinic. I mean, most of them wore the catheter for a couple of weeks. I am happy to say right now that the functions that I was concerned about are really good, and I'm really happy about that. I have not had no problems with either, and the only thing I'm concerned about now is did they get the cancer? But that's kind of what happened to me in my procedure, and you know, again, my tests are happening right now, and I'm going to be speaking with the doctor next week and finding out exactly what the results are. Anyway, just so you understand, especially for those of you that maybe have just found out that this might be an option for you, if we can maybe get that video on. And this is the one, I believe this is the Ablatherm one, if I'm not mistaken. This is the robotic one. But both systems are quite similar in how they work. It's just, again, one is robotically controlled and one is controlled with a doctor's hands. But
Keep talking, I need a minute.
oh, no problem. Anyway,
Maybe more.
no problem.
So you said you chose one over the other.
Yes.
What prompted that decision, or is that later in your talk?
I was going to talk about that. I can give you some of the reasons right now. I looked at the statistics, I guess. There was one of the things with the robotic, the little robotic probe that I guess I didn't like, and that it had, even though they have a cooling system around it, they have a little bag with a cooling system around it, but they created a lot of problems with people inside the rectum, and they had a lot of burning inside there. And then later on, they had a whole bunch of, you know, like infections and sloughing of the walls and so forth. And I didn't see that as much with the other one. And so I guess that was one of the concerns that I had. And then I guess, and just my belief, I believe somebody that's been a doctor for a number of years. And by the way, I checked out the doctors at this clinic, and they've been MDs for quite a long time. I know they've just been joined. The clinic where I was at, they've just been joined by a gentleman.
Hello, I'm Dr. Stephen Cianti,
University of Toronto,
Director of the Minimally Invasive Prostate Cancer Treatment Program at Coastal Carolina Urology. Thank you for visiting our website at HIFUcarecenter.com.
Let's try this, Gary.
I'm Dr. Steve Cianti. I'm the Director of the International Prostate Cancer Institute. We're based in Hilton Head Island, South Carolina. Our specialty is sophisticated prostate cancer diagnostics. Targeted diagnostics in our practice lead to targeted, individualized, customized therapy. In our clinic, our goal really is to match the right treatment to the right disease category. And so the whole focus is moving prostate cancer treatment to the next level. In the past, we've always taken a shotgun approach. We've assumed that prostate cancer is prostate cancer and all men have the same prostate cancer. We know today that's not true. And so consequently, we overtreat some patients and we undertreat some patients. And really the key is to really define the extent of disease in the prostate using some very sophisticated 3D and 4D diagnostic techniques. If we can identify exactly where the cancer is and the extent of cancer, we find that some patients really can do extremely well with what we call focal or customized or individualized therapy. In other words, if the cancer is in a regional area, and we can see that by sophisticated imaging, sophisticated biopsy techniques, we can then go ahead and target that region for destruction. And really what it's all about is preserving that all-important quality of life. For us baby boomers, and I'm now in that group, quality of life is important. We're not ready to give up our sex lives. We're not ready to be back in a pad or a diaper. And really, we need to define the exact degree of treatment for that specific disease in that patient. And that's really, I think, what gets us to cancer control and quality of life. The optimal candidate for targeted or focal therapy are those men with early, low-risk disease that's confined to one region of the prostate. so we can target that region and kill that region, preserve quality of life. And really the only way to know that really is to do the proper targeted diagnostics, because that's what leads to proper targeted individualized therapy. Well, when a man gets a diagnosis of prostate cancer, he's faced with a whole range of treatment options. And this is confusing. The reason it's confusing is because most men don't really know the type of disease they have in the prostate, or really the extent of disease. Is this a prostate cancer in which the entire prostate's involved? This is an aggressive, angry cancer. That requires a totally different approach. That requires an aggressive, total gland prostate cancer treatment approach. On the other hand, if we catch this disease early enough, then there is the opportunity for a much more targeted, less aggressive therapy. But what this really means is if you get the diagnosis of prostate cancer, then the most important thing before really knowing what the best treatment option is to get the proper diagnostics. Again, sophisticated, proper targeted diagnostics can lead to targeted therapy. On the other hand, if you've got a prostate cancer that involves the entire prostate, and it's an angry cancer, if it's a lion and not a lamb, we need to treat that differently, and the treatment recommendations are going to be very different. So the bottom line is it's important to really get good information about what type of prostate cancer you have and how much of the prostate's involved and where it is. 25 years ago, when I entered the field of urology, we really only had one good way to treat this disease. That was surgery, radical surgery. And so the answer was, if you have prostate cancer, then automatically we arrange the operation, we take the prostate out. But today, this disease is changing. We're finding the cancer earlier in men. We're finding lower degrees of cancer. And what we're beginning to understand is that in certain men, this cancer really is regionalized. It's confined to certain areas of the prostate, and that we may not need to be as aggressive as we were 25 years ago. Our diagnostic techniques are getting far better. The ability to see the cancer on sophisticated MRI imaging, the ability to look at the prostate in what's called four-dimensional imaging is now present. Technology is driving this. We have better ways to define the cancer, and because of that, we have much better ways to treat it. That's exactly where the option for focal therapy comes in. 25 years ago, we wouldn't have thought about this because, number one, we had no way of defining where the cancer was. And more importantly, we had no treatment that we could target to the prostate. It was either remove the prostate or don't remove the prostate. Today, with sophisticated technology, such as focal cryotherapy, we have the ability to zero in on the cancer if it's in a specific region and kill that area. And what that really means is we find a better balance today between cancer control and quality of life. The real difficulty with prostate cancer is that we use the same word to describe every patient, but every single patient is different. This cancer can be a very tiny little area of slow-growing cancer in 5% of the prostate. That's what I call a lamb. And that's a cancer that really requires minimal therapy. On the other hand, if a man is diagnosed with a disease that's what we call a higher Gleason score, what that means, a faster growing, angrier type of cancer. In that particular situation, it may involve all the prostate. Now, those are two very, very different situations for men, and we're going to treat them differently. The real key is to be able to identify and zero in on what type of cancer a particular man has, because it's not all the same. If you've got a lamb, we're going to treat it with a very minimally invasive approach, and we're going to spare a lot of quality of life. If you've got a tiger, if you've got an angry cancer, we need to go after it. We need to cure your cancer. And there may be some quality of life issues there, but it's important that you survive your cancer and cure of that first. So the key is proper diagnostics, proper characterization of that cancer is what's important to define the optimal way to treat this disease. That's really what we specialize in at the International Prostate Cancer Institute, located in Hilton Head Island, South Carolina.
I'll try the Maple Leaf site.
Yeah, sure.
Maple Leaf.
I wasn't very specific about HIFU, but boy, what he said was So right on.
Exactly.
Okay.
Situation.
Do some more questions.
One of the things that I found out through questioning my doctor was, in terms of erections, there's basically two big nerves that come up from inside of your body, and when they do an operation, they really can't see the nerves, is the way I understood it. The nerves are kind of underneath, so when they cut you open, the doctor's looking at your prostate. Again, it's pretty small. The nerves apparently are kind of underneath, and you really can't see them. So anatomically, they know where they're supposed to be when they're cutting. Oh, and that's whether they're doing a radical prostatectomy or whether they're doing laparoscopic, where they put the little robotic arms to your belly button and the cameras and they put a couple of holes in you and put little robotic arms in there, and the doctor controls the robotic arms with his fingers about 20 feet away. But in both cases, whether the imaging is really up close or whether it's a doctor just looking at you, they have a hard time seeing where the nerves are. And that's why when they're removing them sometimes, they nick them or they damage them or they stretch them or they what have you, and then that's when you have problems. So one of the things that they were able to do that I found out with this HIFU is, it's a series of little tiny rays that they shoot out. And so they do one where they hit the whole prostate, and they do one procedure where they call nerve sparing. And he asked me, which one would you like? And I went, nerve sparing, please. Well, that's good and that's bad, because if you think about it, I mean, if they're going to be putting a little probe inside you and shooting little rays right across the whole size of your prostate, but then every time they're coming by where the nerve happens to be, they're kind of easing off. They don't want to zap that nerve. So in other words, they're not zapping or they're not hitting with the waves the whole prostate because they're trying to stay away from those two nerves. So I guess you could look at it and say if there's a few cancer cells that are right beside the nerves and you don't hit them, then months or years later, those things are going to multiply and you've got cancer back in your prostate again. But the location that I had, they weren't near the nerves, and they were down kind of on about 2/3 of the way down at the bottom of the prostate and towards the middle. So he said that wouldn't really be a problem. So I had a technique called nerve sparing where they shot the whole prostate gland with waves, but they tried to avoid the two nerve areas, the urethra and the two nerve areas. And I think they did pretty good because I told you those two functions are pretty good. The question now is, of course, did they get all the cancer cells? And because mine was only in 1 out of 10 needles, the urologist right here, my urologist here in Calgary told me that the size of my prostate, of my cancer, is probably pretty small. He figured about the size of 2 peas, one on top of the other one is kind of the way he described it. So that's a pretty small little piece of cancer that they're trying to hit. And just the location of it, I think, was good that the nerve sparing technique worked. So that's kind of what I chose.
With any luck, Gary, we may have the video of the HIFU.
Okay. Oh, yes.
The Ablatherm HIFU device is made up of 2 modules, the treatment module, on which the patient is positioned, and the control module, which enables the surgeon to plan and check the treatment via a computerized system, which guides the robotic endorectal probe. The probe is installed on a mobile support. The ultrasound generator and the integrated ultrasound scanning equipment, or transducers, are located on the end of the probe. The probe's mobile support is an instrument with robotic movements, which enables the device to move the probe automatically and extremely precisely during the treatment to treat the whole prostate. After a local or general anesthetic is administered, the patient lies down on his right-hand side and stays in this position throughout the treatment. The probe is lubricated and then inserted into the rectum via the anus. This non-invasive position enables the probe to be positioned near the prostate, which is then accessible for ultrasound treatment. The first phase of the treatment involves an ultrasound scan of the prostate. The computerized system will then recreate the prostate in 3 dimensions to enable the surgeon to plan the treatment on the screen and to program the robot to define the area to be treated. Once the treatment has been planned, the shooting phase can begin. The robotic probe will then carry out the surgeon's instructions automatically and extremely precisely. Orders are accurate to a few millimeters. Every 10 seconds, the probe generates a high-intensity focused ultrasound beam, which is used to destroy a very small part of the prostate with intense, very fast, highly localized heat. This phenomenon generates almost no pain for the patient after treatment. This elementary lesion will be followed by a number of adjacent lesions, several hundred in fact, which gradually, one after the other, enable the entire prostate to be treated. The treatment then continues, lasting between 1.5 and 2.5 hours, depending on the volume of the prostate.
Very good. You're telling the right one, Gary. Any more questions for Gary? Right here, Ken and Fred.
Hi, Gary. You didn't mention that this really wasn't a treatment invented in Canada. It's
No.
had extensive use in Europe.
Yeah, and I'll give you the information that I discovered about that. This was invented in Germany. And when I started doing the research, and again, I called several countries and actually found people that could speak English, and one would lead me to another number, and it's a pretty interesting little scenario. But I found out that this is not a bizarre technique in Germany or France or England or places like that, or Japan. And I don't know about you, but I've always looked at the Germans and the Japanese as pretty technologically advanced. I mean, these are not silly cultures. These are very advanced. And I'm thinking, if this is pretty common and has been used extensively for 10 to 12 years in Japan and Germany, and again in France and England, Brazil, places like that, I have a lot of confidence in that. And a lot of the studies that I read that were in English were results from 200 men done here, 300 men done here. So that's the thing. You're not going to find, at least I couldn't find statistics that showed, 20,000 men or 50,000, or, I mean, you can do that with radical prostatectomies, right, because there's so many of them. This is a relatively new, so the studies are 50 men, 71 men, 142 men, 250, 300 men, that's one of the bigger research studies. But the information the numbers that I got, like when I would look at a chart for the information, it would say, how many men who have this procedure who were normal sexual activity and possibility of erections and all those types of things beforehand. Of the ones that had what they would call a normal sex life, 90 to 95% still had the ability to do that. Of the people that could urinate normally without dribbling or going, or having a BPH or having to go 6 times during the night, people had kind of a normal urination. It was like 85, again, 90% of the people, and that was the German studies, the French studies, the English studies. So when I looked at that, I thought, this is really interesting. I mean, it's non-invasive. Yes, it's relatively new, but every one of these reports, time after time after time after time, I was looking at numbers in the 80s and 90%, sometimes 95% in some of them. And these were not studies put on by, you will also find studies obviously put on by the companies, I will tell you that. And they're obviously going to make, I think, make the numbers look pretty good. Because I would, if I owned the company, I suppose, I would look for a research study and publish one that looked pretty darn good. But the numbers from Europe are remarkable. In fact, one of the gentlemen, in fact, I don't know if you remember, but when I was at a prostate meeting over in the next hall over here, that was back in February, and I stood up and said, has anyone ever heard of HIFU? And one gentleman put up his hand, and that one phone number that I got led me to a gentleman in BC, who led me to Toronto, who led me to France, and it was really interesting. And there was somebody in the crowd also that came running up to me and said, well, I just found out I have prostate cancer. And that gentleman went over to Japan to get it done, and he had his done 2 weeks after I had mine. And at substantially more cost, but I asked him about it. We were emailing each other for quite a while, and he said over there it was quite common. I mean, they have clinics all over the place there, and they were whipping them through like one after the other. They've been doing this for 10 years. So I think it's much more accessible and much more prevalent obviously in Europe and Japan than it is here. And again, I was mentioning that the FDA in the United States has not okayed this, by the way, just so all of you know that. So you're not really supposed to be doing this in the United States. So Americans actually come up to Toronto to have it done, or they go down to Cuba or the Dominican Republic or Brazil to get it done, or Europe, but quite commonly down to one of those South American or Central American countries. And in Canada, we don't have anything west of Winnipeg now. And the company that I use, they just opened up this clinic in Winnipeg, and I was, again, I think about 3 months ago. So this is relatively new in Canada. Not a lot of people know about it. And again, I don't think a lot of the urologists here in Calgary alone, and I think we have a fantastic urologist grouping here in Calgary. I mean, to have prostate here with Bob and all you people here that help with that, that's fantastic. The Prostate Cancer Institute, where I volunteer, I mean, just to have a little library with pamphlets and books and reports, apparently that's kind of unheard of right across Canada. There's only 2 or 3 places that have that, which is really sad when you think about it. And I think in the United States, probably even less so. So, I mean, there's a lot of work that needs to be done, a lot more studies that have to be done. I'd like to maybe read you a couple of things that you should be aware of with HIFU, some of the facts and the numbers. Pros and cons, I guess, if you want to look at it that way. First of all, before I had my procedure done, they asked if I would have all these done. I had to have an ECG done. If you smoked, you had to have a chest x-ray done before they would even take you into Toronto Clinic, which I don't smoke, so I didn't have to have that. But you obviously have had to have had a biopsy report and a Gleason score and send that information on. You have to have a radionuclide bone scan, which I had to have done here in Calgary. Some people have to have a trust done, just in case they don't meet the parameters again. And so I had to get these things done here in Calgary before they even okayed me having this done. Then they sent me some information. Here's some of the common side effects from HIFU, whether it's the robotic one or the doctor held. You could get additional protein in your urine. You could have pain in the treatment area, in your rectum or scrotum area. Sudden completely inability to urinate. You could have difficulty with urination. You could have a UTI, which is a urinary tract infection. You could have pain and swelling and tenderness in the scrotum. You could have infection of the prostate. You could have blood in the semen or ejaculation fluid. You could have blood in your urine. You could have retrograde ejaculation, where the ejaculation is going back up inside you instead of out of your body. Less common side effects: urethral stricture, bladder neck, where the bladder neck constricts and they've actually damaged something there. Rectal wall injury or rectal fistula. Rectal incontinence, where you have leakage of stool. I knew about all this before I had the procedure, but when they sent me this information, I looked up all the information on the internet of study after study after study. I found the numbers very small. Like some of these things I just read off, the numbers out of every 100 men would be 0.3, 0.5, 1.2, and I'm thinking, well, I can live with that. If 90% of these side effects they're talking about, 1 or 2 out of 100 men have that happen, those are pretty good stats. I'm looking at 95, 97, 98% where this is probably not going to happen to me, and none of these things have happened to me. So. And again, that's just one person's story, but yes.
One thing you haven't mentioned is how successful is it at controlling cancer? You've talked about the side effects and what are these other countries finding?
The numbers are as good, if not better, than surgery, cryotherapy. I mean, I found some sites where they had charts and they would compare 4 or 5 different methodologies with 200 men, 300 men, 400 men. And the numbers on the HIFU were always the highest of any of the procedures. So I was looking at, that's another thing I looked at. I thought, this is certainly no worse, and by the charts and the information I've seen, better than any other method that I'm seeing with the less harmful side effects. And so that's one of the reasons why I went for that. Now, that's not saying that surgery's not great, and cryotherapy and brachy and radiation and all these things aren't fantastic. And HIFU is definitely not for everybody. And there are some restrictions, of course, like I mentioned, but if you fit the right proper parameters, like I do, I think it's certainly something that perhaps you could look at. I think the cost factor for some people will be prohibitive. I mean, I got lucky because I got in that study. But to shoot out $25,000 or $30,000, unless you have a pretty darn good health plan, that's a little bit prohibitive. I think some people wouldn't have that done alone just because of the cost factor. I also see a time down the road when I think it will be covered by Alberta Healthcare or Ontario or whatever provincial healthcare, and then I guess that won't really be a concern. I'm assuming that's probably what's going to happen. Yes, sir.
Did you have any sophisticated diagnostic procedures before you had this done?
Well, I had a bone scan. I had the scan that they do when they're doing the biopsy. I had of course, the Gleason score, the PSA scores that I had done. Kind of pretty much like I guess any normal person would.
The doctor was talking about MRIs and
Right.
sophisticated.
Yeah, I had an MRI as well. I went in here to
So
Calgary.
did you have any, clear picture of what kind of cancer you had before you had the procedure?
Yeah. I did, yeah. Like I said, I have a bone scan, an MRI done, the PSA numbers. By the way, they won't treat you with HIFU if the size of your prostate is too large. And mine was about, I think about 90% up to the limit, because after that it's too big and they won't. Also, that's restricted for
What is
HIFU as well.
large? What do you consider large?
I think mine was 34, if I'm not mistaken. Mine is what we call the size. Sorry?
Small.
Not according to them, it's not.
Well, that's average. 35 is average, isn't
Yeah.
it?
Well, I'm just telling you, for high food, that's the size. Like if you have a 45 or 50 or so, I've heard of some numbers like people have 85 and so some I don't even think they would do high food on you. Again, they're looking for like the gentleman said there. It's something that's localized, something that hasn't gone out of the capsule itself, out of the prostate gland. If it's gone into your bone, if it's metastasized or gone into your lymph glands or anything, it's kind of a useless. It's used for a cancer that's relatively small, that they detected fairly early. They can localize it and they can nail it with those waves and get at it before it really expands. So again, it's not for everybody, for sure.
I just have,
In the back? In the back there?
Yes.
Gary, with their pre-treatment diagnosis, is it possible to determine where the cancer is relative to the location of the nerves you were talking about?
Yeah, and that's what they told me. They sent the information to Toronto, and then when I talked to the head nurse, I talked to the doctor. His name was Dr. Robinette, and he's one of the 5 doctors that does the operation, or I guess I should say the procedure in Toronto. And he told me, and he used all these words I didn't understand. I said, in layman's terms, where would you say this is? And he said it's kind of in the center left of your prostate when you're looking from above, and it's not near either one of the nerves, and it is relatively small, and it's kind of what the doctor told me, the urologist told me here as well. So, yeah, I think they have a pretty good idea when they before they do the procedure, where it is and how big it is, and whether.
Who determines that information? Who does that diagnosis?
Well, I think my urologist here described it to me as well. He gave me a pretty good idea of where he thought it was, and it matched what they told me in Toronto as well. And I didn't tell them in Toronto, I just sent the information on, and they basically substantiated what he said. So.
And one more question, if I may, please. Does this treatment destroy the whole prostate?
Basically, well, it depends on how much they hit. They hit all of mine outside of the nerves, and I asked them about that. I said, do I have any prostate left? And he said, you still have little pieces of prostate left that are attached to the nerves, but outside of that, the rest of the prostate, within 9 months, will slough off and disintegrate, and you basically don't have a prostate gland left.
Is there any problem with not having a gland?
Outside of not having any fluid during ejaculation, no.
One more.
Because that's really what the prostate does. Right? It supplies, I think, 80-something% of the fluid.
Mr. Todd.
yeah, quick question. I'm delighted to hear that there is a procedure for men whose cancer is at a certain stage.
Right.
But given the strict exclusion, I would think, of most men with prostate cancer, is it fair to even compare this procedure with any other procedure? Who, like surgery, they take the tough cases.
That's right.
So,
And what you're saying
is
is
it a fair comparison? Because
it depends where you are with your cancer, but you bring up a very
I think
good point.
for that group, it's great.
Absolutely.
But for me, I would have.
That's what I'm saying. If
Not
you-
qualified.
That's right.
Yeah.
So a lot of people aren't going to qualify for that methodology. It's not going to.
So it's hard to compare, because you're dealing with different clientele,
You're right.
different patient
Yeah.
profiles.
Yeah. Although a lot of the studies that I read compared people that had comparable cancers,
Really?
you know what I'm saying? So if you're saying, you know, can you compare a radical prostatectomy where they can hit somebody that's just full and someone,
Yeah.
no, then the comparison isn't fair. If you look at people that have, you know, cancer, like maybe I had a Gleason of 6 or less, and the other person had a Gleason of 6, so that's a pretty good comparison. A lot of the studies did that. And those are the ones I looked at too, but I thought about that when I was looking at the stats, obviously.
Gary, thank you so much.
Yeah, hopefully that gave you a little bit of information.
Very.